Essentially, when I start out, of course, I have my laptop on, I click the new patient button.
Let me get a shot of that.
And I get a profile up just to enter and get a file situated, okay? And that would be the patient. Essentially, what I've done is put in basic information. I'm not going to go into addresses and everything like this. Date of birth, widowed, social security number, and we have a drop down here for the nursing home information, so I don't have to type all that out. Hit process patient, and it'll enter this patient into the XLEMR software. Then I pull up patient records, type in the first 3 letters of the patient's name, and there she is right there. Open it up. Open up her file, and I'm ready to go. Okay, bring it on over here. Keep it going. This is essentially the format. We've got the vital signs, the prognosis. We've got the chief complaint with an explanation. We've got different reasons for seeing the patient. On a new patient, you wouldn't need it, but on a follow-up visit, patient request, family request, nursing request, diagnostic results requiring follow-up visit, regulatory visit, telephone orders. I list those to show work being done during the month. And also consultant pharmacist requests, which is work done that we never really get to claim. I don't think you can bill this individually as a thing, but combined with all the other work, people see what's going on. Then I have history of present illness to make sure that I meet the bullet requirements. I have location with an outline, and what I can do is click on here and type in or write in with shrift that then translates to type. I have the acute present illness and the past history of the present illness. This would be about the hospital stay. This would be about the rehab when I do a return visit. Then I have a set of problems. The first problem being any acute problem. I usually leave it blank, but that's where a UTI, URI, skin tear, bruising, pain evaluation would go.
Did you help design this system yourself, Dr. Hannan?
This is based on a system that I had before in Lotus Notes, but with trip weeks, we came up with this system here.
Very, very custom to your specific request.
Exactly. We have the diagnoses here, which you select and click in. We have the medications here, which is, I got to admit, a little tedious, but once you get used to it, it's got all the dosages here that I particularly like to use, and I get a consultant pharmacist tell me which ones are appropriate and not. Then we have guidelines from Medicare to tell us just where we are with the patient, whether they're active, whether you're inactive, whether resolved. And we also have the guidelines that we use for risk here, which we can actually insert in the note as to what we feel it is. Then we have an assessment. The assessment of the problems right here, you can click on that. You can pull up a shrift, and you can write here when you have his laptop, go to the well, and insert it, and there it is right there, go to the well. It gets to know your writing, and as a laptop, it's quite convenient. Or when you're in a mode with a mouse, you can do drop downs, which I have, such as no signs or symptoms of worsening, doing well, continue medications such as hospital, monitor side effects, follow PT-INR, INR 2 to 3, COVID and toxicity drug monitoring. And then we have the plan, where I also have drop downs with various things such as getting labs, such as monitoring for symptoms, monitoring for CHF, hemoglobin A1C less than 7. Just to speed up, we have the improved, worsening, and unchanged levels of care, but that is also taken care of in the drop down from that we made based on the Medicare guidelines. Have up to 15 problems, 14 if you count the acute problem as being vacant.
You've mentioned Medicare guidelines a few times. Do you feel more compliant with this system than you did without it?
I personally like to have the guidelines because I like to get reimbursed for the work that I do. And I feel that over the last 20 years, I have been underbilling and undercoding because I just didn't know. Now that I have those there, I can immediately see just where I am. So I wish to be reimbursed for the work done. Here is just an evaluation of the patient with the ADLs, the diet, risk factors, these past medicologies. Then we have the review system with all the bullets involved, and you have a place where you can fill in, for example, chest, pulmonary, cough with green,
sputum.